I'm going to start at 2 o'clock. Thank you for coming. Can I welcome our guests, Chief Inspector Gary Cook, who's here when we look at the Community Safety Plan. Can I also welcome Kelly, and who else have we got there? Sarah. Thank you, Sarah, from the Alzheimer's and Dementia. So really pleased to see you here, and of course Andrew and Victoria for our safeguarding items. So we've got a busy meeting today. I'm just going to go first to the record of the meeting that we had on the 21st of November. Is everyone satisfied that the record of the meeting is correct? Okay, and we'll deal with any actions at the end of the meeting. So can I say that that's agreed? Thank you. Are there any urgent matters by reason of special circumstances? I have none. Okay, thank you. Okay, and there he is. There's Martin. Nice to see you. Help yourself to a drink, Martin. We're only on item 4. Any declarations of disclosable pecuniary interests or other significant interests, please? Okay, nobody? So we'll move then to our first report, and that's the Kent and Medway Safeguarding Adults Board Annual Report. We're just being asked on this occasion to note the report and to give any comments, but can I first of all thank the Safeguarding Board? It's a really comprehensive report, and the Safeguarding Board provide lots of training throughout the year to help us keep our adults community and indeed the children's community in other ways safe. We get lots of case studies which help us understand what's happening, and although the board isn't a delivery board, it certainly directs actions and ways of working that help us, I hope, keep as many people as possible safe. So with that, I'll hand over to you, Andy.
Thank you, Chair. Grateful to be here and grateful to be so early on the agenda. It's nice to actually start. One of the things I always think is really important with these presentations, one, who am I? For some of you might not know me, I should have started with that. My name's Andy Raby, and I'm the chair, the independent chair of the Kent and Medway Safeguarding Adults Board. And I'm here together with Vicky Whiddon. Vicky is the manager of the Safeguarding Adult Board, and she writes this report, she compiles all the detail, and she knows all the answers to your difficult questions, more importantly. There's not a lot I can say, really, because it is there. This is our report, which actually captures all of the activity that's taken place in the year 23 to 24 around adult safeguarding across Kent and Medway. A couple of changes we've made to the report this year from feedback we've received is we have an executive summary which summarises the detail of what we've done, and we've also put a specific section in that highlights the Medway work separately. The SAR process is slightly differently because it's a joint process. But I just want to touch on one point before I open for your questions, and that is this annual report. This annual report is part of our process of assessing and ensuring delivery against our strategic priorities. Our strategic priorities were set in 2022 and end at the end of this year in 2025. So we are, along with other methods, holding to account all of the agencies for the delivery of safeguarding practice against those strategic priorities. We also have a responsibility of carrying out safeguarding adult reviews, which provide learning and opportunity. And I just want to leave you with this point, because this is really important. Since the commencement of these reviews, we've had a total of 204 recommendations, and 162 of those recommendations have been completed, with 42 outstanding. That's 403 actions, 320 which have been completed. Now, I, having worked in the public sector for over 40 years, know that sometimes completion of actions and recommendations sometimes can actually be a tick box process. But we follow that up with a self-assessment framework, which is peer assessed against those strategic priorities to ensure the embedding of those processes, and that we're continually checking to show continuous improvement against those priorities. So I want you to be reassured that when we actually say things in these reports, then we provide you with data, it's tested, it's thorough, and it's accurate. Thank you. I'll leave you open to questions.
Yeah, thank you very much, Andy. And sorry, I didn't turn my microphone off when I was speaking, as I should have done. But before we start, can I draw people's attention to some of the achievements and actions on page 17 and 18, because that really shows the way that we've worked across the system on safeguarding with Andy's team and with our own teams from adult social care, and indeed NHS partners and partners in the blue light services. And I think a real step forward this year has been a new approach to looking after people on the edge of being in a safeguarding situation, on the edge of care, particularly those who are self-neglecting and hoarding. And we've had some really good results with our teams, wrapping around those people, doing physical clearings and working with them going forward to make sure that they understand that a change of lifestyle is needed. You know, these are real conditions and can lead to people being very poorly and unsafe indeed. But we have started with our social work teams to work in a very different way, and I think that's been hugely successful. And I'm grateful for everybody that's joined me and other staff at events to promote safeguarding awareness. That's been particularly successful this year, and it's been, I think we covered every shopping centre in Adult Safeguarding Week and had lots of conversations with people about what to do if they're worried about somebody, be it a friend, a neighbour, or a relative. So I think your reach this year actually has been very strong, stronger probably than last year. And the learning that's been done on an interagency basis has been really important. So, Victoria, did you want to say anything before I open it up to everybody else?
Is that working? Just thank you to everyone really, because it's a combined effort for all the agencies, and it's quite a lot of time and investment and commitment, and we get really good representation. So just a thank you really. Thank you.
There has been really good attendance, I think, at some of the joint events and training that you've held this year. Okay, anybody please. Tracy.
Thank you for the report. It was really comprehensive, so much detail in there. One of the things that I particularly wanted to comment on, it follows on from Teresa mentioning the community engagement events, was a really marked upturn in people engaging with the website and people accessing information. So clearly really successful events. And I think it's just so important because often, well not often, but there are people who are not really using social media so much. And so actually these face-to-face events are a really welcome addition to the way that you communicate with people in Medway. And I noticed in there that you're continually looking at other ways to engage more people as well. But that was very impressive, the number of additional contacts following on from these events that you had. So thank you.
Thanks very much for the report. I've got a couple of questions, one specific and one more generic, if you like. One, the generic one is more in relation to costs. I mean, obviously, there's contributions from local authorities and stuff like that. But on the ground, just give an indication of how much it actually costs on the ground to do all the work that's done here. Can you give us some examples of the actual sort of different service, how much it might actually cost? Because it's huge, isn't it, in terms of delivery and stuff like that? And just be nice to see, because there's no figures in there, but it'd be nice to...
Yeah, do you mean different agency costs?
That kind of thing.
And we don't really collate that. We are provided with budget by the statutory agencies to run as a management group to support the delivery of safeguarding. But the delivery is actually through the agencies themselves. Yeah. We really, I think, set the strategic direction, and we set the sort of the standards of expectation, and we measure those standards. The delivery is met by the costs by the different organisations. So, for instance, Medway, Adult Social Care, Jackie would probably tell you, or Leanne, that the amount that they spend out. We have the same with Kent Fire and Rescue, Kent Police. Each will do their own. So if you took, for instance, Safeguarding Awareness Week, each agency commits to activity. What that costs is a difficult measure because it's within their normal business, because safeguarding is all of their business. It's set within their strategic priorities, it's set within their delivery models, and actually what we do, we ensure that actually it's being delivered in a way through an independent chair that actually is there to say, is this the best that we can be doing? Are there other things that could be done? Here's some good practice that we found elsewhere, and this is the data that we've got that shows how we're doing things. The Safeguarding Adult Reviews is a great example. You know, we review cases, sad cases, when people die in terrible circumstances, and the agencies are open and honest enough to sit down and go, could we have done that better? So together we work at actually making recommendations to ensure businesses improve. So it's a continuous improvement model. We talk about that. It's written into the annual report, and we mean it when we say it. So I haven't really answered your question, I know. No. A typical sort of ramble round the outskirts, but I don't know.
It's really helpful to hear it from that perspective, because obviously, you know, I understand how, you know, collectively there's a whole range of agencies involved and stuff like that, and on the ground it's a really difficult calculation to say how much does it actually cost. We don't really know, is what you're saying, and that's
I was sitting in Gary's seat once upon a time, and preventative measures are you can't measure them, but should we do them? Of course we should do them. And actually the activity that everyone puts in, we use a term, noticing isn't nosiness, which is our slogan. And that actually costs nothing, but actually delivers an awful lot. Because if a neighbour spots that Andy Raby is actually starting to struggle to get his bins out and the problem, he might refer that into adult social care or do an assessment and save a fortune by actually getting the right support in for that individual at that time. So it's that continuous behaviour and activity that actually creates that safeguarding environment we encourage.
More specifically, on one, forget which page it was now, within the report, you've got this area about who cares for the carers.
Yeah.
And I think that's hugely important. I mean, just sort of on a personal thing, I've noticed it in one instance where the carers involved were getting a lot of racial abuse from the person they were caring for. And how you manage that and how that is dealt with, I'd be interested to know if you could give me a little bit of detail about how you go about. And I know it's not easy, honestly, but it is extremely difficult, I suspect.
I'm sure Jackie will help me with this. The first thing I would say is, the racial abuse of any carer is not acceptable, and I know that Medway have specific plans and processes in place to actually deal with that, and that should be reported. The second point I would say is support for carers is actually written into statute and actually is within the Care Act. And all agencies have a process, and the local authorities are responsible for carrying out care needs assessments. But what you raise is a specific issue. And I think if there's detail that you have of that, I think if you were to report that in, that would actually be dealt with, because that's unacceptable.
Thank you. I've got Jackie coming in, but before I bring Jackie in, Simon, that's a really important point that you've raised. I'm afraid that behaviour is on the rise. And indeed, we've had some difficulties at the hospital in the same way, with staff being very patients and visitors being very abusive towards black and ethnic minority staff. And it might be that we bring it back to the Health and Wellbeing Board, because in our discussions this week, I'm not sure that the council has got a secure way of dealing with those incidents. At the moment, we've only really got the health and safety policy. So particularly now the diversity board through HR and Councillor Van Dijk is up and running, I think we do need to develop some procedures ourselves for dealing with this that we can share with other agencies. But I think it's important to say publicly now, it's completely unacceptable. How dare anybody abuse someone who's looking after them racially or otherwise? That really isn't acceptable. We've got to protect people's working conditions and protect the way the circumstances that they go into. And actually, it starts to cost more money, apart from anything else, because we're having to send 2 people in where we might send 1 in order to protect them. So there's a job to be done here in educating everybody about what our expectations are, and in making sure that we've got policies and procedures to deal with this, and helping our partners do it as well. Jack.
Yeah, thank you. Councillor Curry, Teresa and I were talking about this in the week. It is something that we see regularly. We are often having to move our carers, so people to different carers, because the care agencies will change carer, but actually it gets to a point where they say, we're not prepared to look after this person anymore. So we're then moving them around. And we have had occasions where actually we've run out of agencies. And that causes a problem. So we're always thinking about what can we do differently. We've had scenarios where we've had to talk to people about, actually, if you continue in this way, you can't stay in this care home. So very difficult conversations, and there's a whole legal route, and I know that Jane will be going through the same sort of scenario at the hospital, but we have to then consider, do we continue providing the care? If we're giving you enough warnings, but that's a whole legal process in itself, but it is something we come across regularly, but not just to carers, to our social workers. And very, recently we've had some very difficult cases where the social workers have been abused, threatened, and so on and so forth. So that was why my conversation with Councillor Murray this week about the no tolerance policy. We need to put something in place. Going back to your other comment, I can't give you the figures today, but I can give you an idea, and I've also got some really good news too. So if you look at page 2, I think it is, 56 on the papers, it talks about the increase that you can see in the number of concerns. So in 5 years, we've had 73.7% increase in safeguarding concerns raised. So us being able to keep on top of demand has been very difficult. At the moment, we've got 13 social workers, so frontline social workers, and we've not been able to keep on top of demand. That doesn't include senior social workers and the team manager. But just to give you an idea, in the Cabinet papers this week, and the proposal going forward was to increase the number of social workers by 4 this year to try and help us keep on top of demand. That in itself is just around £220,000 for those 4 social workers with their on costs, so not the actual cost. So you can see what that is starting to look like from a cost point of view. The thing I wanted to say about the potentially good piece of news, all subject to everything going through council, is we also included in the papers about the introduction of what we're calling a MIST team, so our Medway Intensive Support Team. That team will be working with those people that are hoarding, self-neglecting and so on and so forth to try and stop them going into hospital, or actually if they move into hospital that we can then pick them up and take them out and then support them, because what we know is happening is that we're clearing the properties, we're putting the care in for a period of time, but that neglect, that self-neglect and that hoarding restarts again. So we want to make sure that we're keeping on top of that to try and stop people going back into the acute or their decline, meaning they need to go into a permanent care home.
Thank you, Jackie. And of course, that work does mean as well that if you don't address those circumstances, people can't go home. So that then has an impact on the hospital. So the MIST team is really good innovation, I think, and something that we need to monitor closely and see more of. I've got Eddie and then Gary and then you, Mark. Okay.
Thank you, Chair. I'm really glad that there's recognition about carers. So even though I don't quite work in the same environment, I used to work at care home, now work in mental health, I've experienced that firsthand. Working for a company where they're very, very big on us following procedure and raising safeguards, but I've been involved in can't say that word, situations, thank you. And you think afterwards, well, what about our safeguarding? It's like a total lack of just taking it for granted. The very fact that we work alone with people that potentially can be very, very violent. Called the police numerous times. The other month I was training, there were 3 nurses in uniform in a care home for the elderly. The issue about racism came up. There were 3 nurses from Africa, and they gave some, because we're discussing how does this training apply to you, what do you do? And they gave examples of the verbal abuse they get. Just phenomenal. And these are people who are doing what I call the full Monty. So that's personal care, really, really supporting and helping these people. And when you spoke to them, they just kind of just soaked it up. Just like took it as part of their job, just took it for granted. And I thought, God, they really are heroic. They have to be of a certain type of what I see as a hero, compassionate person. But it still doesn't make it okay. It's still not right. So I'm glad that at least you're recognising this. So having said that, I've got one very specific question. On page 28, you refer to carers, 90 carers attending, and that sounds like an impressive figure. Do you know how many carers there are, though? What's that 90 out of? Have you got any idea at all, please?
We're not sure about that to hand, to be honest with you. Can you just give us the context? Is it in relation to training?
Sorry, let me just find it again. So I went ahead, so I wasn't ready for you. So, it's the what we achieve section. So to me, that's a particularly interesting section to read. And it's actually page 27. Who cares for the carers? The board and community safety partnership hosted.
Apologies, Councillor. Could you turn your mic on, please?
That would help. Sorry. No. Did you catch what I said? Thank you, Simon. Yeah.
Yeah, so that was just sort of one of the events, and it is recorded for others to see as well. So that they're sort of multi-agency practitioners. So some will be carers, some will be from lots of different things. It's, as is always the way with our sort of voluntary, they're voluntary things to attend. But what we do try and do is do lots of different things. So we might do events in the evenings and lots of other things to reach carers. We've got a carers action plan in response to SARS, so there's quite a lot of other activities, but in terms of the proportions of carers you reach, I haven't got that information to hand.
Rough idea, do you think?
Well, it's a very difficult thing to actually measure because a lot of the activities we have to put on have to be on a voluntary basis, and carers can come from so many different walks of life that we have to create environments. So we do an evening events, webinars, because we recognise that actually some people are carers are actually working full-time, can't come during the day to different events. So how many carers there are that actually is a percentage of, I think it's really difficult, unless Leanne and Jackie are going to answer that question.
Yeah, I think, Eddie, what we're saying is it's a difficult question to answer because it's not just carers who come along to those seminars, but we'll do our best to give you a picture of that outside of the meeting. Okay. Andrew, I've seen you. So Gary first, Mark, and then you, Andrew. Oh, sorry, Leanne's before you, actually, Andrew. Thank you.
Thank you, Chair. Just a couple of points building on what's already been spoken about today. So hate crime within a care setting. I echo all the points here about the abhorrence of that, and we can't just simply accept it. We need to get those crimes reported, and we'll find a way of dealing with it. The criminal justice system may well not be the outcome that we're looking for, but safeguarding, finding support for our carers must be at the top of our kind of priority list. We've done some work in the hospital, in and around that, in terms of supporting colleagues there, and in specific care homes within Medway. So that's something we're looking to do and take forward. I'd just make a comment on Mr. Raby's team and the work they do. I've worked in homicide investigation and led child protection, and that work is just absolutely crucial and fundamental to our learning and providing that better service for Medway. Absolutely, without it, and engaging with it fully is what we do. It's our priority in Medway, trying to learn from when tragically mistakes are made, because we just simply can't afford to make them again. And the last point on cost from Councillor Curry, just from a policing perspective, we look at where there's stretches and strains in the system elsewhere. I can't quantify it monetarily, but in terms of resource for policing and our ability to meet our demands elsewhere, that does become acute in terms of cost to resource there. So that would be a point I'd be rightfully making on our behalf. But they were just a few points to cover on that and reassure members here today about our approach.
Thank you, Gary. And your point's noted. Mark?
Thank you. When the Chair began introductory remarks, he referred to, and I genuinely mean this, he referred to an impressive experience of the public sector. I wanted to ask a little bit about how we work with the private sector. When I see reports like this, I always think our communications must be very good with GPs, with third sector bodies, with housing associations, with the police, picking up cases, but particularly in hard to reach areas, and you spoke about holding evening events for carers. I'm just wondering how many cases of people in difficulty we're picking up, who might be in full-time employment. Do we have good communications with private sector employers? Do we have communications with the gambling sector, through our licensing team and what have you? To what extent are we picking up victims, quotes, unquotes, through the private sector contacts?
A very good question. And I think you're absolutely right to raise it. We do have good links with, for instance, KHOG and the housing association groups in relation to safeguarding. We regularly meet with them. In fact, we were there a couple of Fridays ago to talk about the rollout of a new system of actually supporting people for the multi-agency work. There's also the care homes and domiciliary care group, whose name escapes me, that we Kicker, who represent over 400 individual privately owned companies, and we link with them. There's a member of them as part of our safeguarding board, so they sit on the executive, and they regularly, I've been invited to some of their events as well to talk about safeguarding. So you're absolutely right. I think it's really important that other sectors understand what safeguarding is, and they actually do affect. I think you raised a really good point about the gambling sector and how much that actually impacts upon safeguarding. But at the end of the day, as a safeguarding board, we also have a duty to ensure that the statutory role of the Care Act, that everything sort of comes into the public sector, needs to be done and effective. So we actually look at the outcomes as much as the input. Preventative measures, which is what you're talking about, are crucial, and we put a lot of effort into actually improving that year on year. And I think this report probably shows an improvement from the year before, and I think next year will show a further improvement in the way we engage with the private sector as well as the public.
Thank you for that point, Mark. Leanne.
Thank you, Chair. I just want to say thank you to you, Andy and Vicky, for the work that you do as a board. I sit on a lot of boards, and you are actually probably one of the most efficient boards that and safeguarding partnerships that I work with. So I think that deserves recognition, Chair. The SARS are interesting because it's sometimes disturbing and disappointing to see the same lessons having to be learnt over and over again, and surely we must be able to do better than having to learn the same lessons through every new generation of the workforce. So I wouldn't mind a comment on that. But I also, and you allude to it, because the good thing about this report is you extract Medway's data separately from the bigger Kent. But from your viewpoint, what are some of the things that Medway is doing well in terms of good practice, and where do you think we could be doing better, and how can this Health and Wellbeing Board support that? So just a general picture.
Well, the toughest one. Funny enough, I was thinking about this, and I'm going to stick my neck out a bit here with this one, because you talk about continuous improvement, and yet the data shows us actually that more reports are being made on a regular basis, that actually the numbers of safeguarding concerns are rising, and yet we put so much effort into it. And I was reflecting on my sort of time in policing and the 43 years in public service, and I used the analogy of domestic abuse, and I remember in the early days in the 80s when domestic abuse was reported, the response to it was probably pretty poor. And yet the numbers were much lower, and the numbers were far lower than they are now. And yet, do I think we've improved in our responses to domestic abuse? Do I think we've improved in our responses to safeguarding alerts from members of the public? Yes, I do. And I think that actually leads to an increase in the reported numbers because people feel confident. I think what's important is how we respond to repeats, how we actually make sure that repeats aren't continually happening, that we deal with effectively those reports when they're made. So turning to your next question, I think that's what Medway does well. I think it does respond well to repeats. I think the MIST, and it's the first I've heard about it, is a brilliant step forward. You know, we've been crying out for activity around self-neglect, to see someone make some tangible steps to improving the response, to actually look at things collectively as well is another strength of Medway. So you don't look at things in isolation. You have the ability as a unitary to look at the actual issue collectively and actually bring in partnerships to actually work on that issue. So I think that's another strength. And I think because of that unitary position you're in, because everyone's round the table, you have that advantage of being able to actually have a positive step forward in relation to activity. You can quickly get public health involved. You can quickly link in with adult social care or the police because actually they're around the corner, it's the same people sitting around the table. So I think Medway have done that very effectively. I was interviewed for the CQC and I was pleased and I felt the buzz that was in the room when I was in Medway. I felt that actually people wanted to be asked the questions about what do you do and how do you do it because they were proud of what they do. So, you know, I've long worked in Medway. I've worked in Medway most of my life. And so I know Medway well. But I do think, and I say this genuinely, that Medway's in a good place at the moment. And I can see that you're progressive. There is two ways of dealing with difficulty. One is actually to attack it and actually think of new ideas. The other is to regress into, this is our statutory function, that's all we're going to do. I learned in 2008, when the first financial crisis hit, that we made a mistake in actually that regression. You need to be positive, you need to step into it and actually do more because actually otherwise you're left with a real bad situation. And I think Medway does that really well.
Thank you, Andy. And just before I come to you, Councillor Lawrence, I mean, it's important to note that, actually. And I think one of the things about MIST is that it's a grassroots staff idea that people have, you know, thought together, what can we do to tackle this? And actually have been given the space to come forward with an idea and get that idea resourced and do that, as you say, fairly quickly and feel a high element of professional satisfaction about doing so. So hooray for us, that's what I say. Councillor Lawrence.
Thank you, Chair. I'd actually put an hour aside to read this report and it wasn't long enough, I can tell you. So next year's report will have to be 2 hours, I think. I've got a few general questions. The detail's way beyond my, where I am really on some of this stuff. There's an awful lot of doing in the report. How are you checking that the doing you're doing turns into action at the more front-facing element of it? For example, the self-assessment tool that's been designed. How do we know, or how do you know, that that self-assessment tool is being used and actually it's making change for people who come into contact with those agencies? I was just interested, this is to March 24, which is almost a year ago. When was this report actually published? The other bit is, I suppose the impact question follows on from the self-assessment tool. How are you getting the impact back? Are you hearing it? Do you triangulate the impact? If an agency says we've done X, Y, and Z, what difference is that actually making? I'm wondering how much genuine sharing of data there is between all of these partner agencies. I think our housing team are trying to collate data from lots of sources within the council that might identify someone who's likely to become in need of temporary housing and then hopefully head that off before they end up at midnight banging on the door saying, can you please help me? So I'm wondering, the NHS and some of these agencies are using very ancient systems. And for me, if we're going to be much more proactive, we need to have access to data that's pooled and shared. And my final question was, and I'm happy to be shot down in flames on this statement, is that we seem to be very reactive in adult safeguarding, that things occur and then we react to that. And I think the fact that we do these adult reviews shows that is the case. I also have a personal feeling that corporate entities get held accountable for safeguarding failures, not a lot of personal accountability within those corporate entities. I know it's not an adult issue, but for example, at Nottingham Maternity Hospital, the corporate entities paid a £1.6 million fine, but no one's been sacked or held accountable personally for those failings. And I think that's a real issue in some parts of our public sector. So I was wondering, can you, from the work you're doing, help us think about defining and creating new services so that we can be more proactive than reactive? I have a feeling that this area becomes ever expanding. It never contracts. We have to put ever much more money into safeguarding activities. Now, I'm not saying that's wrong, but where does this end? How much bigger does the envelope get, and how much more money will it consume in a time when we have very limited amounts of money available to us? Thank you, Chair.
A number of points. I think I did touch upon it about the continuous improvement, and one of the things that we are really keen to ensure is that everything we do is looking about practice. You know, you can read all the policies you want, but it doesn't drive practice, there's no point in the policy. So we look at that to actually say, are we getting evidence provided to us that shows that practice is improving? And the way we do that is a number of ways. The annual report is about going out to all agencies, districts, safeguarding teams, charities, people who work on the front line to ensure that actually they are delivering against those strategic priorities that we've set, which are quite straightforward in what we're asking them to do. So we actually look at to do that. We also run the self-assessment framework. Now, you could argue the self-assessment framework, well, what are you going to say about yourself? You're going to say that you're doing it really well and it's excellent. But those individuals then rag rate themselves. And then we put together a peer team that goes in and asks questions of those individuals to say, prove us and provide us with the evidence that you're doing it. And if they don't, then they're rag rated down. Now, that rag rating then comes to us as a board, and for 18 months, we assess against that rag rate until it's changed to a green. If it's not changed in 18 months, then I'll write to the CEO or whoever that organisation is and ask them to account to me as to why they have not changed or improved in the processes that they're actually delivering against our strategic priorities. Because the strategic priorities is not just a booklet on the shelf. For me, it's an active document that I hold everyone to account in terms of their delivery. We have a quality assurance working group, and that quality assurance working group is made up of all the agencies that make up safeguarding and others, and their job is to constantly look at the delivery and ensure the quality of the delivery at a practitioner level. Again, we look at policies. Our policies and procedures group is looking at all of our policies that actually sit amongst safeguarding. And I mean collectively, I'm not talking about individual agencies, also collectively to ensure they're delivering against the standards that are put in place. And we make sure through those groups and into us as a board and to me that actually we're reassured against that. And I report to Leanne and Councillor Murray to actually ensure that they're satisfied as an executive that we're delivering and the area is delivering the highest standards of safeguarding that we can possibly do. Now, on your question about increasing numbers, is it ever going to stop? You know, that's that catch-22, because as society changes and grows and the expectations of how we treat each other and how we actually react to each other, people report more. They have more ability to report incidents. They have the issues when they go to the hospitals, etc. So safeguarding is a changing feast all the time. What was acceptable in the 1970s isn't acceptable now. And we expect people to be dealt with in a better, more supportive manner. And that's what's expected of our public sector services. So it's, I don't think it's ever going to suddenly stop. And some issues I don't think will ever change. There's the Climbier report, which was back in, I think, in the 80s or 90s. They're still finding that the issues that were raised in that are still occurring now. And, you know, and are we saying we haven't improved with the Children's Act and the issues that have been put into legislation? And the Care Act is exactly the same for adults. And your last point was, now one other point I just want to raise, because this is a really good one. Southend across the water, they've got a brilliant safeguarding team and a guy that's a manager there. He has a data set which does exactly what you're asking for. Now, Southend are a unitary, a bit like Medway, and what he's done, he's an ex-fire officer, and he's devised this system whereby actually he collates and he overlays CSP data, safeguarding data, crime data, and he can actually show pockets of issues that are occurring across the whole of Southend in a way that means you can do targeted work. And I think that's what you're getting at. I mean, you know, there is so much data we would love to have. There's so much data we'd love to overlap. We don't have the resource within our management team to actually deliver that. And actually, when we look across, and I've just had this conversation with Leanne, is how do we create that model that gives us that proactive, forward-thinking process? Part of what we have to deliver in safeguarding is preventative measures, and a lot of what we do is about prevention. I think I said it before, Medway are quite good at that and at the forefront of thinking how are we going to stop this happening, because we do need to get to that point. You know, what does good look like? It doesn't always mean a reduction in numbers, but it actually means what do we measure that, and I always think repeat is that if Andy Raby is referred to for a safeguarding issue, we don't want to keep coming back to him time and time again because we haven't delivered. I hope that helps.
Okay, just quickly, Councillor Lawrence.
Yeah, sorry. I mean, Chair, I think it's an obvious recommendation that we go look at what Southend are doing and see if we can bring some of that back to Medway. I think part of the Medway 2.0 project is about collating data. Just one more comment then, Chair, since you're hurrying me along. I was very struck by the fact, I think Leanne made a comment about the repeat incidences of poor safeguarding that leads to real concern. But you then talk about assurance, policy, getting in there, but we still get these repeats. Is that just the human element of what we're trying to do, or is there something more systemic going on? And I think we mentioned about generations of new workers coming through, and we do obviously there's a lot of migration of people working in this care sector. So is it a training issue? What do you think is going on that we can actually eliminate some of the worst instances of safeguarding failure? Thank you, Chair.
Yeah, I'm running out of things to say, but I'm going to get Vicky go first so I gather my thoughts.
I think just it's important to note as well that they're not all sequential. So some of the Safeguarding Adults review will cover the same time period. So you may have 8 safeguarding adult reviews with the same recommendation, but they will cover the same time period. I think also nationally, when we look at what's going on in the national picture, both Andy and I are really linked in, as are, the board, everyone else here, but, with what's going on nationally. And there's just not that long ago been the second national analysis of safeguarding adult reviews. Unfortunately, what we're finding locally, we're not outliers. They are those big systemic issues that, what we find, when you're in the details of some of these safeguarding adult reviews, it's how you work with, individuals who keep, for whatever the reason, and it's not a blame at all, who say, I don't want this, I don't want that, thank you very much. And, how you work with policies and with agency time, how you keep going back, how you have those conversations, how you manage that in line with your policies and procedures and your budgets and everything else. And there's just so much going on, and I think we're trying to look at that nationally as well with our partners and do things nationally to try and shift things. We have an escalation process for safeguarding adults boards. Andy has had to put that in twice where we think there's a significant concern. We contact partner agencies, partner boards to see if they've got a similar scenario, and so that we can try and influence government in relation to that. So say, for example, placements, mental health placements, and the availability of placement. So it's that kind of that influence. But there's as a board, there's things that are sort of movable that we can do locally, and then there's things that require that more systemic shift. So, thank you.
Andy, before you come back, if you want to, I've just got Jackie coming in and then David. Okay, thank you.
Thank you. So just from a local point of view, Councillor Lawrence, we look at those repeats. I mean, they're generally ones anyway, so sometimes the occasions are simply because, as Vicky says, people don't think anything's wrong. So we'll have a neighbour say, we've got a concern, and we go out and they don't recognise it. And actually it takes quite a period of time for us to get in and know, and you can get different people then come in and saying that there's a concern. So there can be repeats in that element. With regard to how do we make sure we're learning internally, we do all sorts of things, lunchtime learning sessions and so on and so forth. But it's the so what part that I haven't been seeing specifically across the board. So actually by what we're doing, what difference does that make to people's lives? Recently, up until recently, we've had the principal social worker. We now have a principal social work team, and they're focusing on doing much more around reflective practice. So working with individuals. So if we're seeing something that hasn't gone quite right, they're working with that social worker or that frontline worker to sort of talk through what's happened, why has it not gone as well, and then look at how we can learn that way as well. So lots of different things taking place to try and resolve that. Please.
Thank you. So just on the issue of data and the system you described in Southend, we might be able to help you with that in the Public Health Intelligence team. So we have created a number of maps that overlay different kinds of data together and create an interactive map. So maybe we can have a chat afterwards and see whether we could make something work.
Thank you, David. I don't see anybody else, so we'll add that to our recommendations, and I'll go to the Vice Chair. But just before I do, Jane, people around the table will know that you have resigned from Medway, and congratulations on your new post in the Sussex Trust. I'm not sure if this will be your last meeting. It might be, actually, at the Health and Wellbeing Board. So I think it's important to thank you for everything that you've done for Medway, and particularly for the contribution you've made to this board, and to wish you very well in your new endeavours. And with that, back to your old job.
Thanks very much. Sorry. The Health and Wellbeing Board is asked to note the annual report. I think there's just a couple of recommendations around looking at what Southend is doing, but also taking up the offer from the Director of Public Health. So,
thank you. Is that agreed, everybody? Thanks. So I'm going to move on to the next item now, the Community Safety Partnership Strategic Assessment and Community Safety Plan. Another really important item, particularly given the high profile that people give to community safety when we ask them in the Health and Wellbeing Survey, and subsequently in the work that we did towards our joint strategic needs assessment for our health and wellbeing strategy. People put their safety and welfare as a very high criteria for whether or not their well-being is in a good place. So I think it's important to see the context of this. And with that, over to you, Ian and Gary. Thank you.
Thank you. I'm here today to ask the board to comment on not just the community safety plan, but our annual strategic assessment. And that's an important document, and that provides the live blood of the plan. It puts it in a modern context. It puts it in this year. For those that haven't seen me here before, the community safety plan is a route that the council, along with its partners, seeks to ensure community safety in Medway. Now, it's not Medway Council alone. There are 5 strategic partners. That's Medway Council, Kent Police, Kent Fire and Rescue, the Integrated Care Board and the Commissioning Service. Interestingly, the Police and Crime Commissioner isn't one of those partners, but we work in close collaboration with them. The background each year is we produce this strategic assessment that's refreshed, and it relies on the data not only from the community but also the partners, and that gives us a steer of what the hot topics for the year are. They're not surprising. They're violence against women and girls, they're tackling antisocial behaviour, tackling drugs and alcohol, and reducing reoffending. You know, and they're dealt with as broad aspirations for those partners. They're the direction we want to go. Underneath that strategic assessment are lots of other subjects that are considered, but they're the focus points that, if you like, those individual partners are going to coalesce around to try and improve Medway. It's important to know that, as the Chair said, that the Community Safety Partnership doesn't exist in isolation. There's a protocol in place between the Health and Wellbeing Board, both Adult and Children's Safeguarding Boards, and the Corporate Parenting Board. And we work collaboratively with those because there's a huge Venn diagram, and in the middle there's lots of common areas. There's only one other thing to always remember, and I seem to bang the drum about this relentlessly. Every year the Community Safety Partnership gets £106,000 from the Police and Crime Commission. We will get that again in April. Two-thirds of that is spent on projects. If you've got something where a modest amount of money might make a huge difference, and some of that money every year goes to some of the charities dealing with domestic abuse, safeguarding issues, I'd encourage you to throw your hat in the ring and try and get some of that, because some of these small projects make a phenomenal difference to our community. Happy to take any questions. Some of it, remember, for Gary and I, we are only two of the partners. We might have to do a takeaway and make a response to you.
Thank you very much, Ian. And I know that Councillor Patterson has been promoting that ability to do focus on those small projects. For me, and before we take questions, there does seem to be an increased focus in the survey and amongst people on the difficulty that people encounter when they see people dealing or using drugs. That seems to me to be a higher profile this year. So some comment on that would be welcome. Otherwise, I'll open it to everybody else first.
Yeah, thanks very much, Teresa, and thank you for the report and the details of it, and for being here this afternoon. There's a lot in here, and it's absolutely really sort of crucially important in so many different ways. I just wanted to focus on one particular area which comes within my own portfolio within the council, and that's around planning. And how we deal with things. You might be aware that we're just about to publish our local cycling and walking infrastructure plan, and as part of that it maps out a whole load of new areas for people to be able to walk more safely, and cycling obviously is part of that, but it's creating those routes across Medway in order to provide, to encourage people to walk more and be active in their travel more rather than jumping in the car all the time, which is part and parcel of what this board is about as well, but also to provide safe routes for them where it's much more. And I'm aware that the secure by design is a thing that's done quite often in different communities. We don't see as much of it here in Medway. Another area of planning work that we deal with is design codes, where, for example, Chatham has now got a new design code, and we're looking at design codes and planning for other parts of Medway. And in addition to that, we've got a whole load of new developments about to take place through our local plan. As that emerges, that's thousands of more houses and communities coming to Medway in different areas. And again, the design of those is crucially important in terms of community safety. So I just wondered, I mean, it's not hugely reflected in the annual report, of course, because you're dealing with sort of stuff for this year, but at the same time, is that something that's in the sort of forethought that you have behind all this, and the connection with planning and how we deal with our routes and stuff like that? That's my general point there. Thank you.
Yeah, thank you, Councillor Curry. Some of the topics we consider through the year in different meetings is about social architecture, about avoiding creating these voids and these empty spaces that provide a venue for people to do things that we don't like. And you are right. I think it's something that should be more to the forefront, especially with the changes that come in with the proposed developments. As we create these safe walking routes, perhaps we could have a meeting with Kent Police to make sure people feel confident in using those routes and it's normalised. So yeah, I think you've raised an extremely valuable point. I will ask Chief Inspector Cooper what his thoughts are. But I do think we spent a long time doing it, probably 3 years ago, and it's probably timely to revisit it.
My mum might be upset you got my name wrong.
I know. I was desperately looking.
I'll tell her later.
Yeah.
We've only been working with each other a year. I don't know whether that's the effects I've had on you, but it's okay. So I would say in any bit of work that we're doing
in terms of our neighbourhood policing model is strong, and the links to health and wellbeing in all of the work that's done here, the links to substance abuse in terms of crime and how we're working to try and deal with those problems in an all-encompassing sense, other than just trying to deal with issues as they pop up, which doesn't get done. And what you're talking about, open space and new provisions that are on there, our neighbourhood beat officers will engage wherever those areas are and look at the design of those to see what we can bring to that party, and linking in with Ian's team. So I think that work is going on and will continue to go on, especially we talk about other spaces in Medway that, well, we've got derelict issues and stuff like that, and designing it out. So we will continue to work on that, of course, but if there's specific examples that you want us to take away and look at, we'll do that, of course we will.
Yes, go ahead, Ian.
And it's just to say, I've got a small team, the street scene team, and as we have those routes come open, where they do focus on the high street, I can get them to focus on that. So at least as they launch, there's a presence, and people feel some degree of reassurance that there's a uniformed officer that has a patrol there. I can also get our litter enforcement people there, so that actually there's a presence by Medway Council.
Yeah, I mean, just intervening, Sam, it's a really important question, isn't it? I think we've got to work together, particularly where we've got a lot of new build, and I'm thinking of the centre of Chatham, so that we synchronise the ability to take a sort of helicopter view of where we might be building in sort of opportunities for antisocial behaviour. What we want to do is build them out, and also that we get the refuse collection right from the day that these new buildings get occupied. That is certainly something that I've encountered a number of times, and it can really lead to a bad start for occupants of new building. You know, I think the design codes are very helpful, actually, and as we move towards the local plan, this sort of strong focus to developers on what our expectations are is incredibly important, and, you know, shows in this item how the responsibilities of the Council for Health and Wellbeing link right across, and indeed with yourselves, Gary. Simon, did you want to come back?
Sorry, only to say that more than happy I can talk to the planning teams and stuff like that so we can get that sort of set up. Great, thanks very much, Teresa.
Thank you. Councillor Lawrence, and then Mark, I'll come to you.
Thank you, Chair. Obviously, when this came to Regen, I had lots of opportunities to comment now. I think just two comments for this committee. The plan needs to show impact, and there was very little impact in the other plan. There's lots of doing, but there's not a lot of that doing achieved this. And I think that leads very neatly onto, I think Councillor Curry, you made a very good point. We're going to be building 28,000 houses. A lot of those are going to be in estate-type situations as well as on brownfield. Some more social housing undoubtedly than we have seen, and more social housing out of town centres. So how does that impact, and what are we going to do? What's the thinking around how we're going to design those in? So it will be about infrastructure, allowing people to get in and out of the centre. But also we've done an awful lot of building in the last 5 years, particularly flats. What does the evidence show that works? So where we built, and I'm thinking, for example, Chatham Waters, where we got very high density housing, there's a lot of mixed tenure over there. Have we made mistakes in some of the planning that's created a situation where antisocial behaviour or other crime can be created? And are we making sure that that learning goes into the local plan going forward? Now, some of these things are, you know, I imagine some of this stuff, you get hotspots that blow up for a period. There's a lot of activity to try and deal with it. That activity ends and then it blows up. I'm thinking pretty much around the moving vehicle protection, PSPO, one of my favourite subjects, and the new dog protection, PSPO, where we've recruited one officer to deal with the whole of Medway. I'm interested to know, you know, we've got to make sure that when we design these estates that we take all of this into account. I think my only other comment, and it is a comment, Chair, is when you ask the population what they want from community safety, it's what they want is not always reflected in this. And I made the point at the Regen Committee that actually if you asked 10 Medwaynians what is the CSP, they wouldn't know what it is. It's an organisation that receives a fairly modest amount of money, but does really important work because it's driving policy and action. But actually, most people in Medway would not even know it existed. Thank you, Chair.
Gary first, and then Ian. Yep.
Yeah. I think some of those comments are fair, and it's all about the doing. We can write reports till the cows come home, as they say, but it's all about what they achieve and where we go. And I could point to crime data and crime coming down and how many crimes were solved, but I don't think that always helps either. Some of it's the qualitative bit, and it's about hearing from people, and it's about the surveying that's done and the effort. There is some further effort that's going into that this year, I know, to hear those voices about where those problems are, where the impacts are, so we can address them, and also on the policing front, our My Community Voice platform, which we're desperately trying to keep people engaged with, because that's where we hear about where our problems are. We talked earlier about Southend. I wouldn't want anyone to be under any illusions about how we go about tackling crime here. Every month I chair a meeting that's looking at data, hotspots, crime trends, intelligence, and pulling the partners together and pushing my resources as to where those problems are. So it's not a kind of finger in the air approach to policing in Medway. And that's where working with our partners is crucial, because data is not always where the problems are. The problems are where the people tell us the problems are, and our effect on dealing with those. And things like serious violence, crime, county line drugs, I wouldn't want anyone to think that just because they're not explicit in the CSP, they're not being dealt with in a policing sense, because they absolutely are. We've got people out there today doing raids on people's houses and looking to do that enforcement work. But the work here today, and to emphasise, is that partnership work that's ongoing to make people safer, specifically with health and wellbeing, and the links to health and wellbeing issues and crime is absolutely going on. But there's definitely more we can always do and always improve. And I think the points about showing what the impacts are more explicitly does need to be done. I would agree on that. Thank you.
Yeah, I think just before I bring you, Ian, in and then come to Councillor Mark Jones, I think one of the successes actually that you have had is raising the profile of the danger of county lines. And I think informally I've had a lot of positive feedback about the presence of the police at police stations, explaining to people why they are there and what they're doing. I think that has been very welcome, and some of the work that's been done informally with schools. So whilst people might not know what the plan is, I think they do definitely encounter some of the activities that the plan is directing. Ian, did you want to add anything to that?
Thank
you. It's about the public safety orders.
Yeah, about the public space protection orders. The dog management one comes in April, and we're preparing the statutory elements, which is all of the stickers, all of the promotion, and that will probably go live in April with a 6-week plan to do that. In terms of the one dealing with nuisance vehicles, that's been in for just coming up for a year. The last time I looked, and it probably was 2 months ago, I think we'd issued approximately 60 fixed penalty notices for when there's available evidence. Kent Police and my community safety officers issue those fixed penalty notices. They do get paid, and it is a deterrent. It is a challenge, and it's a challenge on a multitude of levels, in that it's identifying those people, it's having viable evidence. Most of the ones that we've issued are for cars and motorbikes on the road. It's much more of a car meet nuisance vehicles. That's what the perfect fit is for that. In terms of the nuisance vehicles that exist in our green spaces, then Kent Police have Section 59, and there's a good fit, and we work jointly with them. We are addressing with it, and you alluded to it. There's a finite amount of resources. We are blessed with an awful lot of green spaces. I'm left there. In terms of the comments about maybe some more metrics to measure these, that's a bit of a challenge I've posed to Neil, and he's having a look at what other authorities do in their community safety plan and see if we can come with some, if not a statistic, at least some indicator, so we can show the direction of travel with some of these issues. But they are phenomenally complicated. And if I do have one ask, for all of the councillors to go away with is to encourage people to report crime. Because that provides us with that intelligence and it provides us with that picture of Medway, and if it goes unreported, then it's very hard to address.
Ian, Councillor Jones, please.
Yeah, a couple of quick comments, Chair, thank you. First of all, on page 8 of the report, page 150 of the papers, it breaks down the top 5 wards for crime. These are the old wards, so just a minor point. They need adjusting at some point, as this is the 2024 report. It highlights River, for instance, as being a top of the list. I remember that well, as I used to be the local member, or perhaps in the context of it being a high crime area, I probably ought not to admit that, but there we are. We need to adjust the ward boundaries at some juncture. Moving on swiftly, what I really wanted to address is children's services, the youth service and education on page 13 in particular, the work which is going on underneath this plan. As Councillor Lawrence said earlier, it's the doing part, and I agree with him on that point. And the work that's going on, for example, the top paragraph of page 13 on contextual safeguarding, page 155 in the papers. Can I just emphasise, and I mean, I welcome any comments from the community safety and the police as to how they're working with the youth service and education, but can I just emphasise the importance of working with schools, etc. It needs to start obviously at the very early years by investment and joint working between health and education to try and imbue in young people the importance of ensuring they don't drop litter, that they do behave, so that when we get to teenage years, the input and the importance of early years and the value of that is recognised and works through as the young people grow up and grow into teenagers. Prevention is an important part of this. And going back to the safeguarding report briefly, of course people are in education very often for many years. They can be in adult education. So in terms of identifying potential service users and prevention, that is an important contact. But I do very much value the working with schools and the youth service and the contextual safeguarding which is highlighted in the report here. And as I say, it's more of a comment than a question, but if the police officer or our officers wanted to say anything more on that, I would welcome it, Chair.
Thank you, Mark. And I think it's important actually to note the good work that's been done by child-friendly Medway on that prevention, particularly with women and girls. I think, you know, that we do have to manage the behaviour of boys, but making sure that girls feel confident about being able to handle any unwelcome behaviour is really important. And I think there's been a special focus on that this year that's been quite successful. So in every context, we've got some good modelling for that work to go on.
Yep, so thank you, Councillor. I'd agree and echo those points in terms of we've got a child centre policing team, they've got a sergeant, they've got in and around 10 people, they're working with all the partners and the boards that you've mentioned here in delivering those services, and it's absolutely crucial. And it's in contrast to what Councillor Lawrence and Councillor Jones have said. It's a paradox of some sorts, because I can tell you all the doing, but we won't know what it's achieving for 10 years, for 15 years, till those children are adults. And I constantly bang on and on and on to my bosses about how crucial this work is. And I've got my officers in primary schools speaking to children, running mini cadets, doing exactly what Councillor Jones is saying and what I hope the members will want them to do, installing those values, those beliefs. But it doesn't offer tangible outcomes in an age where people want data and numbers and graphs. It is qualitative work, and it's so vital and so important. And as long as I'm given that kind of responsibility, and my Chief Constable is saying he's happy with us doing it, and my Chief Superintendent, we will keep engaging and being in those schools and working with our partners, because there can't be anything more important than that from a a societal point of view in 10 or 15 years, and a direct safeguarding point for some of the points we made earlier. So absolutely a commitment on that point. Are the resources there to do so?
Thank you, Chair. You alluded to it with child-friendly Medway and youth services. The Home Office ran Safer Streets 4, which was an initiative to discourage kind of antisocial behaviour. And I think it's 15 months ago, Medway Council was awarded £250,000. That's been used to fund lots of those projects. It's still ongoing. There is a legacy to all of this with children's services. In improving that lot, making people feel more confident, walking around, all of these things that enable people to feel better in our community. We were very lucky to have that money. I don't know if there's going to be another cycle of that, but rest assured that we'll put in for it and we'll try and get that funding. Just to reassure Councillor Jones on a quite humdrum issue that you raised, you know, with the work that we do on children about littering and recycling, there's a real moral compass against that they have. Lots of children are very passionate about littering and they get involved in groups. You know, there's a lot to commend our young people for, and in some ways they can be kind of role models for some of our adults.
Please. Thank you, Chair. Healthwatch Medway did a piece of work over the last year around what affects Medway residents' health and wellbeing. And we spoke to 455 people, and it was about just under 40% of those people mentioned that crime was the biggest negative effect on their health and wellbeing. So looking at the Community Safety Partnership Survey feedback that is on page 169, the themes here are very similar to what we've been hearing throughout the last year. And I was wondering if it might be possible to get a further breakdown of this information by demographic, probably most usefully location. Is that something that's possible?
Yeah, I can certainly do some research and find out what there is. You know, not to shoot myself in the foot. I'm mindful that it's a small data set. So to the extent it's possible, we certainly will. And the only comment that I'd make that, you know, the narrative that we get from Kent Police is the direction of crime is improving, but there's always that perception of the fear of crime, and that's part of the challenge that the Community Safety Plan and that Safer Streets works does, is to try and explain to people, actually, this is a good place to live. There's an awful lot of positives, and to try and change that perception of what they might be faced with.
Thank you, and it's good to hear that Healthwatch are doing that work actually, because in fact, we can meet different groups and it accords across there how people are feeling, so that's important. Right, last comment then, Eddie, from you.
Yeah, it's very interesting to listen to what has been said, and I keep thinking about it. It's very obviously a good place to start when it comes to, I'm not quite sure how to say it. In effect, you're educating, aren't you, with your children. It's not just about passing exams. I never ever thought it should be. It should be about life skills, and it should be about taking responsibility. That includes manners, all the way to specifics like do not drop litter. A lot of these things, as far as I'm concerned, should actually start in the home. These are parenting responsibilities. That's where it should be in an ideal world, but quite often in reality, it isn't. So what I'm trying to say, I'm just trying to think about how to put this. I can see this happening already. We've had some experiences. So, for instance, when Esther and myself, we had a defibrillator installed, we had a choir turn up. I was really pleased to see how many parents were there with their little children. And I was thinking, despite the fact that my mother was a teacher, I can't ever remember once my mother ever coming to any school that I was in or ever get involved. And I was just thinking, the encouragement when you've got these groups of involving their parents is so important. Most probably one of the reasons why children do drop litter is because their parents do. And the example that is set is very important. A lot of parents may well be the first to moan about the amount of litter and then drop it themselves. The very idea of getting involved and never even come into their mind. So that's what I'm just thinking about. The whole part of the mix is getting parents also, and other adults, you don't have to be a parent, involved in these things. So therefore they're thinking about it and also taking ownership of this. And then on a completely different other point, Obviously, it's very difficult to police these things, but when you see the report on fines for cigarette butt dropping, now I was thinking about that because this was on the news last night, and they did report on London Borough Rubbish, where I used to live, and the rubbish are colossal, absolutely colossal, and yet, you know, cigarette butts are only that big. However, it's still very antisocial, and we do seem to have quite a good track record at somehow spotting these people. I don't know if there's people are spying on what people are doing, not quite sure how it works, looking at the amount of fines we're coming in, and the amounts of money do seem quite a lot compared to that crime, but then it most probably needs to be that amount of money to have that impact. So I'm talking about the carrot, which is to encourage, and then stick, which obviously is the fines, and I think it is a combination of those two things. That's all. Thank you.
Thank you, Eddie. And I think it's important to recognise that adult littering is often, and particularly related to smoking, I'm afraid, people don't think of it as littering. They think of it as something else. So the more we can do on smoking cessation, the better contribution we're going to get towards that. Right, well, thank you, everybody. I'll go to you, Jane, to wrap up that item, please.
Thank you. So the board is asked to note the strategic assessment for 2024 and just noting some of the comments around relationship to planning, particularly around the open spaces and new developments, and also showing the impact of actions and considering some other metrics that might be considered, but also consider further engagement of the Medway residents.
Thank you, Jane. Is that agreed, everybody? Okay. We'll move on now to the next item, which is the pharmaceutical needs assessment. And Teresa, that's for you, please. We'll remember at the last board, we had the start of this. Obviously, the survey related to the pharmaceutical needs has been going on since then. So we've got an update there and some information about our next steps. Thank you, Teresa.
Marie. Thank you. So the paper that's been prepared is in line with the process that we agreed at the board meeting in November for overseeing the production and completion of the P&A. And the board is asked to note the progress, as Councillor Murray has summarised, to understand the progress that we've made thus far with respect to this document. So as the board is aware, the P&A is a statutory board duty under the Health and Social Care Act 2012. This function needs to be undertaken every 3 years, and our current P&A is due to expire in October of this year. We've therefore commenced the process as described earlier. If I can draw the board's attention to section 4. So various forms of data are being analysed and considered to understand pharmaceutical need. The data collection process will conclude on the 17th of February, and it includes insights from engagement with key stakeholders, such as local pharmacies and our population in terms of patient groups. We are looking to collect analysis of our population demographics, and health needs. We are also seeking to collate pharmaceutical service provision across Medway, which includes all our providers, dispensing pharmacies, appliance pharmacies, and community pharmacies. One of the methods used to understand need and gain insight has been through the use of surveys. We've therefore conducted 3 surveys over the last 2.5 months, starting in mid-December up until early February, really targeting the public and our pharmaceutical providers. We had a very good response from our residents compared to the response we received in our previous P&A. This time around, we received 974 responses. In the previous P&A, we received about 389. And just glancing at the data dashboard, as data is being analysed at the moment, but briefly glancing at the dashboard, I can tell you that this 974 response represents mainly females of an older age group, largely from Gillingham, Rainham and Rochester. But as I said, the data is still being analysed at the moment, so this is just a very rough and early position. This time around, we had 32% of contractors complete the online survey compared to 64% in the previous P&A. We're very much looking forward to understanding more about this position and what it represents when the data is fully analysed. So drawing the board's attention to point 5 and next steps, Our specialist provider aims to complete data collection and analysis by the 17th of February. This will be taken to our P&A steering group on the 18th of February for presentation and discussion. A draft P&A will be reviewed and agreed by the P&A steering group on the 31st of March. Mandatory consultation on the P&A is planned to begin on the 28th of April for a 60-day period. And then lastly, the final P&A document will be presented to this board for sign-off at its meeting on the 4th of September.
Okay, thank you, Teresa. So quite a complicated process there to actually gather the data towards this survey. I think one thing from the steering group that stood out for me was the poor response from contractors. I think the last time I looked, only 2 had responded, and given the high profile that as a kind of NHS family we're putting on the use of community pharmacy as a way to take pressure off other elements of the health service, especially with the 7 elements of Pharmacy First. I found that surprising. I don't know if you've got any insights on that, and including actually, I mean, I think the second pharmacy on there, I did go to my local pharmacy and beg them to fill it in, actually, and they they did, but they said, you know what, they did do it, but they said, we've got enough to do. That I wouldn't have said it was an entirely positive response, but I was very grateful for the fact that they joined in. So any insights you've got on that, I think would be welcome before we come to the next stage.
I will say that we have 4 dispensing pharmacies in Medway, and we had 2 of them respond. So in essence, we had 50% response. I know I'm jesting there a little bit. But jest aside, I do take your points, Councillor Murray, and it's something that we need to have a discussion about at the steering group meeting next week. I can't comment on that, but I will say that the LPC were really very supportive in trying to get contractors to complete the online questionnaire.
Thank you. Councillor Lawrence and then Councillor Peake, please.
Yeah. Thank you, Chair. I was just looking at the timing of this. I noticed the mandatory consultation on the draft goes out on the 28th of April, but we're not going to see, it won't be back to this committee until effectively to rubber stamp whatever comes off. But there is actually a health and wellbeing meeting before the statutory consultation starts, and I'd just throw it on the open. Is there an opportunity to comment before it goes to statutory consultation? Just on the issue about people responding to surveys, I'm just wondering what impact the online pharmacy world is having on this document we're preparing. Doctors now can send prescriptions all over the place. You don't necessarily have to wait and go pick up your prescription and then take it to your local pharmacy. And I wonder if the whole nature of dispensing pharmacies are changing. And there is, of course, those cost pressures on pharmacies, national insurance increase, business rate increases, and whether that's having the sentiment for pharmacists has changed because they're finding it increasingly difficult to make their way. Thank you, Chair.
In response to your first question, Councillor, with regards to the board commenting on the draft document, when we met in November, we did agree the governance process for the P&A in terms of the timelines and to have it done quickly, swiftly and efficiently. And it was agreed by this board that we would have the document go through that process, but it will go to HASC in August before it comes to the board, if that is...
Sorry, Chair. Yeah, I'll just note the timeline. We have another health and wellbeing meeting in April, right, just before the statutory consultation starts. So I only throw it open. I'm not making a massive point out, no. But it comes back to be rubber stamped by this committee. But my point is, when you go out to statutory consultation, that's the end of the consultation period. It's just another report that we're going to note in when it comes back to us before it goes live in September. I mean,
If the board wishes to change the governance.
I'm just going to bring David in before you come back.
Oh, maybe I'm not coming in.
That's okay. I think Teresa's turned hers off now.
All right. Oh, yeah, there we go. Right, thank you. So clearly, Teresa didn't want me to speak about it. No. So I'm not on the steering group, so I don't want to override the steering group. I think probably it would be quite tricky to fit it in, because if the Health and Wellbeing Board does recommend any changes to the document before it goes out for consultation, that's not going to leave very much time before we actually do the consultation. And the 60-day consultation is extremely important. It's an extremely important part of the whole process. We have to follow that process. That, of course, doesn't stop Health and Wellbeing Board members from commenting on it during that 60-day process. So I think members of the Health and Wellbeing Board will still be able to make comments. They could submit their comments formally as a representative of the Health and Wellbeing Board, or as as a private individual. So you can comment on it, but we just do need to be very careful about that 60-day process that we have to follow.
I'm having difficulty now. Thank you, David. No, I just wanted to buttress what David said. The board will have opportunity to comment on the document. It's just because of the timelines and the tightness of it that we chose that particular governance procedure. Thank you for explaining that further.
Thank you. Eddie.
Sorry, Chair, I did have a few other questions about the pharmacy landscape, particularly the impact of online and also the cost pressures on pharmacy.
Yep. Any?
I think that would be best addressed by our LPC colleagues. As it currently stands, we have a pharmaceutical needs assessment steering group that can comment on those questions, and I can make note of them and have them answered for you there, but I can't comment on them now. Thank you.
I think that would be helpful. Thank you, Teresa. Eddie.
Thank you, Chair. I've got a question which may seem to be implying negative. So first thing I want to say, I really want to shout out how I think potentially a needs assessment like this is of value, because to me, this is what we should all be about. I understand the spirit of what's been said, that we don't just want to be ticking boxes and just collecting data. If this could really, really work, so we actually understand how well the pharmaceutical provision is working, surely this is exactly what we are about, and I support it. However, my concern, especially after you said about stakeholders and their lack of response, is how well you manage to get a response from members of the public, because it does say in paragraph 2, and the public to ensure the updated and so on. Now, as a self-confessed survey form filler-inner, some of us are so sad, but I do this because I'm interested. I'm interested in the world, my environment. That's why I'm in politics. Is the main reason why I'm in politics is because I'm interested. But there's a shed load of people that will spend their whole lives moaning their heads off. I'm too busy to do anything about it. On the other hand, I've got a friend who's a retired maths teacher, so she's got a brain. You talk to her whole raison d'etre is, if it doesn't affect me directly or my immediate environment, just don't want to know. So how many of these people are filling in these forms? It must be really, really difficult to get people to actually do this at a quantity that's actually got some value.
Councillor Peake, we actually got a really good response from the public. How good? We got about 970 responses from the public, and the last time we did our P&A, we got about 360. So we did really well, and I put that down to the really robust comms plan that we had in place, our comms team, Health Watch, the P&A steering group. So we did well. The challenge this time around is that we didn't get a lot of pharmacy contractors filling the online form. And as I mentioned earlier, that is a conversation we will have at our P&A steering group next Tuesday to understand that just a little bit more.
Can I just say that's really great? I'm glad to be stand corrected. That's really good news. Thank you.
That's all.
Thank you, Teresa. So there are no more comments. I'm going to move to the Vice Chair to conclude the report, please.
Thanks, Chair. The board is asked to note the progress made in the development of the PNA.
And as we've heard, it will be coming back again, and we've got the steering group and opportunity for you as individuals to comment as the process goes on. Okay. I beg your pardon? Yes, and as Stephanie has quite rightly said, follow my lead and get the pharmacies in your wards to join in. Go in there and make a special request. Okay, thank you. Right, our next item is about the joint health and wellbeing strategy, and this is our attempt to make sure that we keep that strategy live. So we decided to remember at the start probably of the municipal year to theme the meetings according to the different elements of the strategy so that we can keep an eye on how things are going, that we don't forget that the local joint health and wellbeing strategy exists, and that we frame our discussions around particular elements of it so that we give ourselves an opportunity to comment on the way things are going. So today, this item really is helping us to understand how we go about that process and where the different elements that we'll be discussing are coming from. So if I go to you, Scott, please.
Thank you. And you said most of my introduction, so thank you very much. And it very much, this does dovetail into the forward plan agenda item. As you mentioned, we do have 5 Health and Wellbeing Board agenda meetings this year. So for the next 4, so starting in April, we'd like to theme them against the 4 strategic priorities of the Joint Health Wellbeing Strategy. This is in part to keep reminding ourselves that the board does have 4 priorities. And also remind ourselves that that was based around the data that we reviewed and the community engagement that was taking place in a very kind of thorough process with lots of focus groups, lots of survey engagement. The theme meetings concept is also really to help keep us focused on the excellent work our intelligence team did to build a suite of performance indicators, which not just say what we want to do, but actually are we making a difference and by how much and where, and then also identify the areas of concern during the year whereby potentially we're not having the difference that we'd set ourselves. So with that in mind, the next meeting theme proposed will be theme 1, healthier and longer lives for everybody. Next meeting after that, which I think is May, will be theme 2, and so on and so on, in June. Now, the next meeting theme is really broad, the healthier and longer lives for everybody as the largest amount of health indicators, because it's one of the easier things for us to measure. It's the stuff that's in more of the comfort zone historically in the joint health wellbeing strategies previously. And as we move into themes 2, 3 and 4, we get into what we understand as the building blocks of health or the wider terms of health. So some really kind of interesting, gnarly issues which effectively do come back to health and lifestyle outcome, health and wellbeing outcomes. So what we have done in advance of the April meeting, theme 1 meeting, is have an early review of all the performance indicators. There's over 65 performance indicators for theme 1. Theme 2, there's 16, just to give you some context. So we've gone through them with a fine-tooth comb. We wasn't expecting to bring 60 agenda items in April because obviously we'll only want to have these meetings for 2 hours to keep it really focused. So we've had a look at the trend lines of those areas and thought, well, what are the biggest area of concern? Either because the trend line is going in the wrong direction, or are we off trajectory comparable to our equivalent neighbours? So the areas of biggest concern we identified because they're red indicators performance were healthy weight, self-harm, smoking during pregnancy, immunisation and vaccinations, and cancer screening. So just in those 5, big broad indicators in terms of things which, they're often symptoms and some are causes, and members of the Health and Wellbeing Board, many of their teams have been reached out to already say, actually, something like cancer screening example, it touches many of the board members' work, so we're currently working on a paper. They've been given the early brief that if the board agrees today, we can bring papers to talk about what the actual performance metrics that we've identified are challenging, what can we do about them, what's currently happening, and have that really good discussion so the board can support that agenda and potentially give it more focus. So proposing these for the next few board meetings. Just to conclude this paper, just to remind everyone, there was a set of indicators we proposed in terms of the goals and purpose. So those will be given much more time to get into the depth of the causes of those performance indicators over the coming board meetings. And just thinking, Tass, what we picked up last time of Health Watch actually was what's really helpful for this paper is what have we heard about these particular subjects areas. So giving Health Watch a bit of an early update. Anything that we've heard recently in the last year around those particular areas, we can put that into the paper and say this is what residents have told us most recently about some of these subjects.
Thank you. Sorry, I didn't turn my microphone off at any point there for you, Scott, but I think everybody could hear you. And hopefully, you know, at section 5.2, you can see the importance of keeping an eye on these themes, particularly in the context of the winter pressures that we've seen, immunisation and vaccinations. We're an under-vaccinated population. There's no doubt about that. And so the idea of being able to sort of have a bit of a laser focus on that, we can think about, well, what can we do collectively next year? Or, you know, next.
Okay, so to answer your question about the time period, very broadly, we're looking at the time period of the life of the strategy. So sort of 23, 24 to 28. However, we have to fit in with the data that are available. So different data sets get updated at different times. And also some data sets get published at one point in time, but represent a period of time that's further in the past. So for each of these indicators, the baseline is the earliest or the closest data point we have to the start of the life of the strategy, and then the next data point will be the next data that we have for that data item. And in some cases, some of them haven't been updated yet, so it'll be the same thing for the baseline and the current value.
There's a second question about diabetes, isn't there? So I think, if I'm reading your question correctly, and apologies if not, so in terms of the statistic that's on here around the red indicator for hospital admissions for diabetes or under 19s, type 2 diabetes is mainly just preventable and is affected over a life course. So the under 19s, the under 18 bit is usually almost always type 1 diabetes. People are born with diabetes. But your point is absolutely correct. They are two separate issues. The treatment is slightly different. Clearly there's similarities by being called diabetes, but beyond this data set there is a myriad of data points. I sit on the Integrated Diabetes Network, so many of the partners do here, and there's a really deep analysis breakdown showing the difference in trends. Generally, the trend is going in a really poor direction, and that actually comes back down to the biggest cause of diabetes and most preventable bit is around obesity and healthy eating. So we'll almost certainly be picking some of those issues up in the next agenda, in the April agenda, talk about healthy weight topics.
Chair, just on another point, thank you for that. I clearly didn't read the heading very well, did I? But on the flu issue, you raise a really important point. Anecdotally, I understand that actually a lot of health workers don't bother or don't put themselves forward to get the flu vaccine, and obviously they're exposed to it in the workplace. And I wonder if our social work team, for example, are encouraged to get their flu, and how many of them actually do go ahead and get it. Because I think if we're going to make some changes, we should look internally and what could we do to promote and find what works and then take that out and about. Thank you.
I think that's right. We've got three members here who can help us. So Martin from MCH, Jane from the hospital, and ourselves. Absolutely, we do encourage people, and we have had workplace access to the flu jab. But you're right, it is a difficult thing to convince. But I think there is a degree of cynicism, dare I say, in the NHS about the extent to which vaccinations work, which is surprising, because if we think about history, without vaccinations, we would be a very different population to the population we are now. So, Martin, I don't know whether you would like to comment on that, and then perhaps Jane, and then I'll bring Jackie in to say how we get along actually with our own work.
Yeah, well, I mean, we try and encourage it as much as possible, but this year in particular, the levels are low across, I think, all organisations, across the whole NHS as a whole. So, as Councillor Murray said, we try and promote it, we encourage it, we try and do pop-ups, we try and go out to where people work, so we make it easy as possible. If they do it in their own time at pharmacies, that's reimbursed as well, so we put every incentive in as much as possible, but the uptake is still relatively low. Usually around 60%, but this year is lower. So I think there's more to do, and I think it comes back to a comment made earlier around comms. So it's just that constant messaging about how we get this across.
I think exactly like Martin was saying, it has been lower this year, and we've tried a number of different ways of getting to staff, encouraging staff. As you say, we actually went into our main foyer to catch people as they were coming through. So we've tried a number of routes. I think there's also something about the availability of the vaccine, and then also about funding to be able to get the teams to do it. And actually this year it was a little bit later than it normally was. So actually that did make an impact. So we've fed that back. Because it takes a team of people to go out and do those things. So, but it was later than normal this year.
Yeah, thank you. Same thing. So we encourage all of our staff, our frontline staff. We also get our back office staff asking for them as well. So everybody wants to take them. The other thing that we do is we promote it with the care providers as well, so that we're making sure that we're trying to get that reach out to residential care, home care, etc. Obviously, you can imagine people wandering in and out of each other's houses is not a good thing. So that promotion is done by our commissioning team in a very number of ways, but I wouldn't be able to give you numbers, unfortunately.
Perhaps something for the minutes that we try to focus on in terms of our communications for next year. Just as a straw poll, and before I bring you in, Simon, how many people around this table had a flu jab this year?
On a point of personal explanation here. Not all. Fun enough, my wife used to work at East Kent until very recently, and actually she has asthma, and she did go get her flu vaccine. But I think flu is one of those challenging ones, isn't it? Because you have years when there's very little flu, and then you have years when there's a real epidemic of it, as I think we're seeing this year. But I do think people working in a healthcare setting should, because they're more exposed to it. Be very interesting, Jane, to know how many of your staff at the hospital had time off because they had flu. And that has a knock-on impact in terms of, planned work, emergency work, and across, even in our social work team, Jackie, how many of our staff had time off because they had flu? And, I do think there is, I'm not saying people should have to have the vaccine, because it is a personal choice, and I would never want to impose that. I made a personal choice not to get a flu vaccine. But actually, it does have a big knock-on effect in terms of everything else we're doing. Thank you. Thank you for that point.
Thank you. So just to sort of build on the conversation that's been happening, we are in the process of building up our health protection team within public health, having a few recruitment challenges. And a key piece of work that we've identified for the coming year is to look into perceptions and views around immunisation, vaccination, in particular related to flu, but also looking at MMR in children. Yeah. And we feel we need to start this early, and it's going to take quite a bit of time to get ready for the next winter. And hopefully we'll be sort of better informed about the ways of encouraging people to get vaccinated.
Yeah, thank you, David. And before I come to you, Simon, there is a lot of rubbish talked about vaccinations on the internet, of course. That, some people, and particularly I think that has affected childhood vaccinations and sometimes flu vaccinations. So we do need to be mindful of that and making sure that the correct information gets out there. Simon.
Yeah, thanks, Teresa. And just picking up, before I get to my point, just picking up, I was going to make that point about the influence of social media, which is probably a whole other meeting for us to have at some point about how that affects people's health and well-being. And also, and as one of the politicians around the table, I can say this openly, the bizarre behaviour of the American politicians that are currently in power over there, and their attitudes to it, it's just weird and actually really dangerous, frankly. So that's a political point there. But getting to my substantive issue, I was really making an issue slightly related to the earlier item on safeguarding as well, is about how the joined up nature, and that's why this board is so important, of health and this, or the outcomes here, the healthier, longer lives for everyone theme that is currently being highlighted there, and about the importance of other policies within the council. Obviously, I'll go to my scratched record point of green spaces and how valuable they are, and Scott knows all about that and how that works, and the importance of that, and the latest data coming from Fields in Trust showing of the billions of pounds of savings made if you've got green spaces near where you live. You do not visit the doctor so often. It's as simple as that. And we have a problem in Medway where we don't have enough green space. I know we have quite a lot of green space, but it's not close enough within a 10-minute walk of people's homes, and that's something that we need to address through the planning system in order to improve access to green spaces. And going back to the cycling and walking network that we're now developing, that will help a lot in that respect. So the joined up nature of our policies, and at the other end of the spectrum is bringing forward selective licensing, which will bring about significant improvements to people's homes and the standard of rented accommodation generally, and that brings about better health as well. So we're constantly aware within this committee and within this board about the joined up nature of all our council policies in respect to people's healthier and longer lives. Thank you, Chair.
I think that can inform our discussions actually when we come to look at this theme, because if there's anything that we need to do jointly with any other part of the council, we can. And absolutely on green spaces, look, we're building a lot of flats. We've got to make sure that there's access to outdoor space for all of those people. Eddie, please.
Yeah, I was just reflecting, you just hit it nail on the head about disinformation, and just reflecting about what is the answer to that. But I'll give you a real life example. So when I worked as my main job for a certain company, and we are a support service, frontline service, my colleagues who are literally saying to residents, you have a responsibility, especially during times of COVID, you have a responsibility to go and get yourself jabbed because of the consequences. They themselves would not have it. So isn't that remarkable? They decide, without wanting to go into it, because obviously it's uncomfortable, they cited two things. One was the chip that's in the liquid to control you, and the other one was an attack on people from a certain ethnic background. And they were serious, because to me this is comical, but they were absolutely meant it. It became such an issue that our company, so I mean, I'm not saying I support this, but my company actually then made such a drive to get people to have it. That's how big the problem was. Those that had it had to self-declare on a signature and say, I've had my jab, have you? So I'm now meant to challenge the people I work with. And then they started talking about it being part of your terms and conditions. If you want to carry on working for us, you've got to have it. I don't know if they ever would have followed through to sacking or not, but that's how much it became an issue. And it's all down to disinformation.
That's a helpful insight.
No, I just wanted to say that I welcome the focused attention on our indicators where we're doing poorly at as a board going forwards. Also just wanted to advise the board that we've now received our tripartite letter from UXA, so we will start flu planning in earnest as soon as possible. And the last thing I just wanted to mention is that flu uptake amongst healthcare workers is a problem across the southeast. It's not just in Medway. And it's something that we really do need to get to grips with. As David mentioned, we are standing up a infection prevention control team, having some teething problems, but we will have an IPC team hopefully in place by May.
No.
Sorry, 2 recommendations on this report, please.
So the first recommendation is to agree the proposed areas from theme 1 and that will be presented for discussion at the next meeting on the 10th of April. And the second is to note the report providing the latest data for the strategic indicators in the goal and purpose sections.
Thank you. Is that agreed, everybody? Okay, on to our last item then, the work programme. Stephanie, please.
I'll just take the report as read and happy to take any questions.
Any comments on the work programme? Anything that anybody would like to see added? Are you happy with what's going forward? Obviously, now we'll start the process, as we've heard today, of going through the different themes in the joint health and wellbeing strategy. And I think arising from that, we'll see things that we probably need to examine a bit more. For example, I've had a discussion both with our public health team and more latterly with you, Jane, on the fact that we've got a rising number of caesarean sections in our local maternity department. And Jane, you recommended, if we want to have a look at that, that the consultant who is in charge might like to come along. Because obviously that has an impact on things that we're trying to do, such as breastfeeding initiation. If we've got more people having caesareans, it does make breastfeeding initiation and sustaining breastfeeding more difficult, which is critical to our infant feeding strategy and going forward to our food strategy as well. So, yes.
Thank you, Chair. I would like to see an item on our children in care and their health needs and how well they are doing at some stage during the calendar year, please.
That's very helpful. So I think that would be a very good thing to examine, and it accords with some of the things we've been talking about today, including safeguarding, actually. Yep. Okay. Anybody else? Simon?
Yeah, thanks very much, Teresa. I mean, in relation to the local plan, but not just simply the local plan, about the number of health centres or whatever you want to call them across Medway, and the need for more is an issue. I'm thinking particularly of Lidsing and the problems that's going to cause us as that development goes ahead. For colleagues who don't know, Maidstone Borough Council's local plan has allowed for a significant new community in the Lidsing area of about 2,000 homes, and there is currently no health provision available to them apart from coming over the border into Medway, so it will have an impact. So there's various issues around that might be worth considering here as well.
Stephanie, say about that particular item.
Oh, sorry. You brought that up, and we've actually been discussing that. We were discussing that this morning as to the appropriate timeline to bring it to Health and Wellbeing Board as well as HASC. So we're currently working on that, and we're discussing it today. Thank you.
And I think, we have to overall remember that we'll have an infrastructure first policy, won't we, coming out of our local plan. So this is a good time to discuss it. Okay, if there are no more contributions, thank you very much, everybody. It's actually not 4 o'clock yet, so hooray. 4 minutes return to you for your health and well-being. Thank you.